Hello, it's good to see you back here in this edition of Continuous and Headlines today. Health Minister Nguyễn Thành Long suggested Cần Thơ City enhancing the testing and tracing of COVID-19 related cases. Along with other localities and units, majority of employees working at banks in the area were injected vaccines against COVID-19. The voluntary blood donation program thoroughly implemented by the Steering Board for Voluntary Blood Donation under Cần Thơ City's Public Security and Cần Thơ City's Hematology and Blood Transfusion Hospital. Top news. At a working session with Cần Thơ City on July 31st, Health Minister Nguyễn Thành Long suggested Cần Thơ City enhancing the testing and tracing of COVID-19 related cases. Accordingly, to help Cần Thơ City rapidly, exactly, and effectively carry out COVID-19 tests by early August, the Health Ministry will offer Cần Thơ City a mobile test vehicle, which is assumed by Cần Thơ Medicine Pharmacy University. In the meantime, the Health Ministry will also provide the city with rapid test kits. Besides, the Health Ministry will depute the delegation of leaders of departments and ministerial-level general hospitals, also top experts on testing and treating, to support Cần Thơ City and two provinces of Kiên Giang and Hậu Giang. Cần Thơ City's People's Committee has agreed on the guidelines of carrying out the project named Building COVID-19 Test Sample Taking Booth to serve the pandemic prevention and control task as proposed by Cần Thơ City Science and Technology Department. The city's People's Committee assigns the Science and Technology Department to finalize the expected cost and send to the Finance Department for verification. Procedures of implementing the project must be ensured with the aim to timely meet the urgent demand for COVID-19 pandemic prevention and control. The city also assigns the Health Department to exchange type of transferring and handing over products of the project with the Science and Technology Department, from then timely ensuring safety for frontliners of the COVID-19 pandemic in the city. Cần Thơ City's People's Committee has just released the dispatch number 3029 that suggests the banking sector give credit support for people and businesses to overcome difficulties caused by COVID-19 pandemic. With the spirit of accompanying people and businesses to overcome difficulties and show their social responsibility, the City People's Committee suggested Vietnam State Bank Cần Thơ branch direct credit organizations to consider reduction, expiration, exemption of interest rates, and other suitable solutions to support people and businesses, while suggesting credit organizations to share difficulties. Along with other localities and units, in the morning of August 1st at An Khánh High School, 1 out of 17 vaccination sites in the city, majority of employees working at banks in the area were injected vaccines against COVID-19. In this phase, 3,808 employees working at 49 banks and debt treatment center in Mekong region under BATV Bank have registered to vaccinate against COVID-19. This contingent usually contact clients and have not been vaccinated in previous phases. Vaccination for frontliners is the basic solution that contributes to reducing the number of infected cases and contain the spreading of COVID-19 pandemic. From July 31st to August 7th, Omom Upper District carries out the fourth vaccination phase against COVID-19. In this phase, Omom is distributed 6,703 vaccine doses, which are to be administered for medical workers, public security force, military force, members of community COVID-19 groups, volunteers, forces of tracing, investigating epidemiology, monitor health and residencies, public servants who make regular contacts with other people, people who transport essentials, and people who suffer chronic diseases, and people at the age of over 65. On August 1st morning, the Steering Board for Voluntary Blood Donation under Cần Thơ City's Public Security, in combination with Cần Thơ City's Hematology and Blood Transfusion Hospital, organized the Voluntary Blood Donation Program. With a message of one blood drop, million hearts, nearly 100 youth union members, cadres, and soldiers of the city's public security excitedly joined the blood donation program. After carefully checking and screening, the organizing board received 90 units of blood. So for this year, after 2 times, Cần Thơ City's public security has contributed more than 300 units of blood. This practical job contributes to supplementing the blood reserve, serving the treatment and emergency tasks at hospitals inside and outside the city, especially in the difficult COVID-19 pandemic time. Amid a complicated COVID-19 situation, with the guideline of every small action gives fruitful results, along with setters at all levels, women's unions at all levels in Bến Thủy Upper District have joined hands with the localities to prepare affectionate meals in the pandemic time. Accordingly, with the food source and raw material given by Catholic people, every day around 500 meals are served by women's unions of walls and then sent to forces on duty at medical checkpoints in the district. These nutritious meals have given good health for forces on duty in a type of social distancing in line with the government's directive number 16. In his remarks made at the briefing on COVID-19 epidemic prevention and control most recently, Chairman of Cần Thơ City People's Committee Trần Việt Trường stated that Cần Thơ must continue to implement various measures to contain the epidemic, support people, and supply food to ensure daily meals of households.
According to the report of the Health Department, nearly 20,000 test samples was collected on July 28, and about 13,500 test samples were collected on July 29. 31 hospitals in the area have promoted supervision to proactively prevent and control the transmission of COVID-19. Among them, 28 units have performed rapid screening tests for their staff and patients. 100% of the 30-level hospitals have prepared the screening, categorization, and quarantine zone if a probable infection case is detected. Chairman of Cần Thơ City People's Committee Trần Việt Trường evaluated that the forces have worked night and day to trace and acquire the fastest confirmation test result. Great efforts have been exerted for the test since units had to take on many works at once. The city has control over the epidemic despite its complicated progressions.
The force must closely coordinate and speed up trade for F0 and F1 individual. For places that are considered safe, we must expand the green zones, tighten red and yellow zones, bring F0 individual to place for treatment, so that only the treatment place remains red zones. As long as there are green zones, we must set up checkpoints and strictly protect them from infection.
The Ministry of Information and Communication evaluated that Cần Thơ and Ho Chi Minh City are the two localities that strictly implement Directive number 16, thanks to people's awareness and constant supervision and patrol of competent forces. However, the number of people going outside is still high in 4 districts. Localities should come up with methods to manage shippers and only allow their operations when safety is ensured, and at the same time consider the suspension of household businesses, food and fast food retailers from 6 p.m. to 5 a.m. the next day. Voluntary groups dedicated for going shopping need to be established for areas under lockdown at communes whilst in town. Supervision and checking for medical declaration at households must be promoted and reported to the city authorities at 4 p.m. every day. Especially authorities at all levels also support people in relieving the pressure caused by social distancing.
Food is the most basic need for people. Food must be supplied so that people can enjoy at least 3 meals a day. Secondly, people's physical and mental welfare must be taken care of. We have established channels and expert groups to provide healthcare consultation. I suggest the health sector check and supply the list of experts in mental health and healthcare to take care of people's welfare. Along with supplying food, we must supply essential medicine for people.
The chairman of the City People's Committees also directed the department and sectors to coordinate to organize concentrated quarantine for residents of Cần Thơ City returning from the cities and provinces of Bình Dương, Đồng Nai, and Ho Chi Minh City. Cần Thơ City has equipped ventilators for severe patients at city-level hospital and is mobilizing more ventilators for patients with mild and moderate symptoms at the field hospitals. However, the units need to soon check and prepare equipment, fluxes, chemical and biological products, and report to the health department for timely equipment plans.
And last but not least, we have the updated weather forecast. The updated weather forecast. They just wrapped up this edition of Continues. If you want to watch again in this bulletin, please visit our website kenthtv.vn. And now thanks for being with us. Goodbye and see you next time.